In this channel we offers you a deep dive into the world of medicine and healthcare, where insightful perspectives, medical updates, and expert insights are shares. Join the journey to gain a better understanding of various health topics and stay informed with the latest medical breakthroughs. Today we will discuss about peptic ulcer disease, causes, symptoms, diagnosis and treatment. Peptic ulcer disease, PUD, is a prevalent gastrointestinal disorder characterized by the formation of open sores within the mucosal lining of the stomach or the proximal part of the small intestine. Despite advances in medical knowledge and treatment modalities, PUD remains a significant health concern, affecting millions of individuals worldwide. This comprehensive exploration delves into the intricacies of PUD, encompassing its introduction, causes, symptoms, clinical presentation, diagnosis, differential diagnosis, paraclinical investigation, treatment, complications, and a succinct conclusion. Introduction. Peptic ulcer disease is a multifactorial condition, often attributed to the interplay of various factors, such as Helicobacter pylori infection, nonsteroidal anti-inflammatory drugs usage, and lifestyle factors. These factors disrupt the delicate balance between the protective mechanisms of the gastric mucosa and the detrimental effects of acid secretion. Causes. The primary etiological factors behind PUD are H. pylori infection and non-steroidal anti-inflammatory drugs usage. H. pylori, a bacterium that colonizes the stomach lining, induces inflammation and compromises the mucosal defense, making it susceptible to erosions and ulcers. Non-steroidal anti-inflammatory drugs, commonly used for pain management, inhibit the production of protective prostaglandins, leading to increased gastric acid secretion and diminished mucosal defense. Symptoms. Clinical manifestations of peptic ulcer disease can vary, with common symptoms including abdominal pain, often described as burning or gnawing, bloating, and nausea. The pain is typically epigastric and may be alleviated or exacerbated by eating, depending on the location of the ulcer. Clinical presentation. Peptic ulcer disease can present in various ways, ranging from uncomplicated cases with mild symptoms to severe complications such as bleeding or perforation. Hematemesis, melena, and hematochezia are indicative of gastrointestinal bleeding, a critical complication that demands immediate attention. Diagnosis. Accurate diagnosis is crucial for effective management. Endoscopic examination, commonly gastroscopy, is the gold standard for identifying ulcers. Biopsy during endoscopy aids in confirming H. pylori infection. Additionally, imaging studies like barium contrast studies may offer insights into ulcer localization. Differential diagnosis. Several gastrointestinal conditions share symptoms with peptic ulcer disease, necessitating a meticulous differential diagnosis. Conditions like gastritis, gastroesophageal reflux disease, and malignancies must be considered to ensure precise identification of the underlying pathology. Paraclinical investigation. Laboratory tests play a pivotal role in confirming H. pylori infection, including serological tests, urea breath tests, and stool antigen tests. Monitoring blood parameters such as hemoglobin and hematocrit aids in assessing the severity of bleeding. Treatment. Management strategies for peptic ulcer disease involve eradicating H. pylori, discontinuing non-steroidal anti-inflammatory drugs if possible, and mitigating symptoms. Antibiotic regimens are commonly employed to eliminate H. pylori, while acid-suppressing medications like proton pump inhibitors and histamine H2 receptor antagonists help promote ulcer healing. Complications. Untreated or poorly managed peptic ulcer disease can lead to severe complications. Gastrointestinal bleeding is a critical complication, and perforation can result in peritonitis, a life-threatening condition requiring emergency intervention. Strictures may develop as a consequence of chronic inflammation, leading to obstruction. Conclusion. Peptic ulcer disease, although prevalent, is a manageable condition with advancements in diagnostic techniques and treatment modalities. Early identification, prompt intervention, and addressing underlying causes are pivotal in preventing complications and improving patient outcomes. This exploration highlights the intricacies of peptic ulcer disease, providing a comprehensive overview of its various facets, from etiology to management. A holistic approach that considers both lifestyle modifications and pharmacological interventions is crucial in addressing this common yet potentially serious gastrointestinal ailment. In the second part, we have a case history presentation. A 45-year-old male presented to the emergency department with complaints of recurrent abdominal pain, particularly in the upper abdomen. This pain had been progressively worsening over the past few months, prompting him to seek medical attention. He reported a burning sensation that often occurred between meals and during the night, accompanied by bloating and occasional nausea. Upon further inquiry, it was revealed that he had a history of intermittent indigestion and heartburn for several years, which he attributed to stress and dietary habits. However, the severity and frequency of his symptoms had escalated recently, leading him to believe that something more serious might be at play. His medical history included occasional use of over-the-counter antacids for symptom relief. He denied any significant weight loss, changes in appetite, or difficulty swallowing. Family history was unremarkable for gastrointestinal disorders. His lifestyle involved a demanding job with irregular working hours, and he admitted to high levels of stress. Physical examination revealed mild epigastric tenderness, and routine vital signs were within normal limits. Laboratory tests, including complete blood count and liver function tests, showed no significant abnormalities. Given the persistent nature of his symptoms and the concern for an underlying gastrointestinal issue, the healthcare team decided to pursue further investigations. An upper gastrointestinal endoscopy was scheduled to visualize the lining of the esophagus, stomach, and duodenum. The procedure revealed evidence of a peptic ulcer in the duodenal bulb, characterized by a well-defined, punched-out lesion with surrounding erythema. Biopsies were obtained for histological examination, which confirmed the presence of Helicobacter pylori infection. Upon receiving the diagnosis of peptic ulcer disease, the medical team initiated a comprehensive treatment plan. He was prescribed a proton pump inhibitor to reduce gastric acid secretion and a course of antibiotics targeting the H. pylori infection. Lifestyle modifications, including stress reduction techniques and dietary changes, were also recommended. Follow-up appointments were scheduled to monitor the response to treatment. In the subsequent weeks, he reported a gradual improvement in his symptoms. Repeat endoscopy, performed after completion of antibiotic therapy, demonstrated healing of the ulcer with no evidence of ongoing inflammation. H. pylori eradication was confirmed through a breath test. Despite the positive response to treatment, the healthcare team emphasized the importance of ongoing management to prevent recurrence. He was advised to continue the proton pump inhibitor for a specified duration, and regular follow-ups were scheduled to assess his progress. Lifestyle modifications, including stress management strategies and dietary adjustments, were reinforced to promote long-term gastrointestinal health. Over the following months, patient adhered to the prescribed medications and embraced the recommended lifestyle changes. He reported sustained relief from abdominal pain and improvement in overall well-being. Follow-up endoscopies showed continued healing of the ulcer site, affirming the success of the treatment approach. In conclusion, its journey through the diagnosis and management of peptic ulcer disease highlights the multidimensional approach required in addressing this common gastrointestinal condition. From the initial presentation of symptoms to the confirmation of H. pylori infection and the subsequent implementation of a tailored treatment plan, the collaborative efforts of healthcare professionals and the patient played a crucial role in achieving a positive outcome. Through ongoing support, education, and monitoring, patient not only found relief from his symptoms but also acquired the tools to maintain a healthy lifestyle, mitigating the risk of recurrence.